We are live. We are live. We are live. I'm Dr. Frita, and welcome to Medical Monday, where we give you all of the hot health topics in the headlines. And of course, this week we will not disappoint because there's lots of hot health topics. Let's start with Taylor Swift. Now, I don't know if you're a Swiftie or not, but I know one thing. Her father had to have bypass surgery, okay? Open heart surgery with quintuplets when it comes to bypass, 5 arteries bypass. So we're going to talk about heart disease, what causes one to have that many bypasses, some pros, some cons, and we'll do some myth versus fact and see what you know about open heart surgery. And then I'll give you a weekly dose of medicine. I'll give you a fresh take you just can't get anywhere else. We'll start off talking about Trump's ankles. Yes, his ankles are swollen, they're edematous, they're big, they're bubbling over. He has a condition called chronic venous insufficiency. Is it life-threatening? We'll talk about it. And then we'll talk about Oscar award-winning Lupita Nyong'o because she shares that she has had a battle with fibroids. Sound familiar? Yeah, we were just talking about Venus Williams last week. As it turns out, she was battling with fibroids for over 10 years and just really normalized pain. So we'll talk about fibroids and really a bigger issue, women, and why so often we're just taught to suck it up and to normalize pain. Tell me what you think. What do we need to do about this? And then we'll talk about Ronnie Coleman. How many of you go to the gym and call yourselves lifting weights? How many of y'all think y'all are little mini bodybuilders? Well, let me tell you something. Ronnie Coleman actually was Mr. Olympia 8 times. So he's a legend. And he is sharing that he almost passed away from sepsis. And you'll be surprised who actually saved his life. Okay. Lastly, we'll talk about Serena Williams because, in case you haven't seen, she showed off some gym pic selfies, okay, of her new body, and she's getting a really mixed reaction. What's your reaction to Serena's massive weight loss and body change? Lastly, if we have time, we'll do a 5-minute health check where I'll give you a quick word on different things like recalls, diseases, things that you really need to be aware of. And of course, we are live. I'm Dr. Frita. I'm going to ask you questions. Yes, I am. And you can ask me questions as well. So go ahead, give us a like and a subscribe because I'm giving you evidence-based medicine on this Medical Monday. Let's get this thing started, y'all. We are live. I'm Dr. Frita. This is Medical Monday. Let's get this thing started. And of course, I'm not doing it alone. To my co-host and my office manager, Miss Shador, please come to the front of the stage.
Hey, Dr.
How you doing? Hi. How was your weekend?
Weekend was a couple little sickness floating around the house, so it was okay.
Is he doing better?
Doing a little better, yeah. You know that seasonal, I don't know, summer cold.
Summer cold, right?
Mm-hmm.
Yeah. As long as he stays hydrated, you know. And oh goodness, tell your parents, everybody. I know y'all like to love on each other, but look, the kids got to keep their germs to themselves because they'll be up and
away from family functions.
Absolutely.
So yeah.
Yep. The little kids, they'll be the kids will be up and running and doing fine. But if they give it to someone who's much older, the older person can be down and out.
Mm-hmm.
Yep. We had a busy basketball weekend for sure. So some AAU tournaments for my son and my daughter, my 14-year-olds. But then I had to break away and going down to the country, Shador. We had our family reunion on my mama's side. Mm-hmm. We went to Mount Vernon, Georgia. We were in the red clay with the nets. We had the fish fry. We had all the good old country down home. We had spades table going, slip and slides, water slides, bouncy houses, just good old country down home fun. And for those of you who've been following me for a while, you know that my mama is the 7th child out of 16 children. And yes, we all still get together several times a year. So that's always good to kind of break away. Oh, and then I did some other exciting stuff I'll be talking about. And y'all, please go ahead and put your notifications on. Make sure that in addition to giving us a like, okay, because we're going to give you evidence-based medicine, make sure you subscribe to the Dr. Frita YouTube channel and put your notifications on because I will be appearing again on Truth Talks-Live talking about some more updates, exciting things where we, do an intersection between pop culture and medicine. And so I'm talking about some great topics that will be airing this week, and I will let you know. And if you put your notification bell on and make sure you join my email list, go to drfrita.com and you'll be able to be up to date. You can click the link in the description. It'll show you how to join the email list. Meanwhile, let's get started with this list of hot health topics for this week. Shador, shall we?
Yes.
Let's start with Taylor Swift. Listen, put a Swift in the chat if you are a Swiftie. Are you a Swiftie? I wouldn't necessarily call myself a Swiftie, but I will say I do have a lot of respect for Taylor Swift, especially how she stood on business during this last election, because in many cases, with a lot of her fans and with her fans' parents, they took exception to Taylor Swift outwardly supporting Vice President Kamala Harris. But Taylor didn't really seem to mind. And that's when I realized that she really has a backbone and she does what she wants to do. Well, she has been in the headlines, not because of her political views this week, but because of her father. Her father, Scott Swift, had to have major open heart surgery. He had a quintuple bypass surgery, okay? As in 5 of his heart arteries were blocked. So let's go ahead and play that clip, and then let's get into our myth versus fact on CABG, open heart surgery.
Taylor Swift's dad, Scott Swift, is recovering after undergoing a major heart procedure. The 73-year-old recently had quintuple bypass surgery, a serious operation that creates 5 new routes for blood to flow around blocked arteries in the heart. According to a rep for Taylor, the procedure happened over a month ago, and Scott is now doing well and feeling fantastic. They also made it clear the surgery was not the result of a heart attack. Taylor, along with her younger brother Austin and mom Andrea, were all by Scott's side through the operation and recovery. While Taylor hasn't spoken publicly about her dad's surgery, she has been open in the past about both of her parents' battles with cancer. In a 2019 essay for Elle, she wrote, "Both of my parents have had cancer. It's taught me that there are real problems, and then there's everything else." She later revealed her mom, Andrea, was also diagnosed with a brain tumor while being treated for breast cancer. Earlier this month, she was spotted out and about with boyfriend Travis Kelce. As Scott continues his recovery, fans are no doubt hoping to see him back in the stands this football season, cheering on with his daughter for their favorite tight end.
Yeah, so I pray that he does well. It's amazing. You look at these celebrities with their multi-millions, sometimes billions, and they have the fame, they have the beauty, they have the cars, they have the jewelries. But humans are humans, people are people. And guess what? We're all susceptible to diseases, to disorders. But that's why you come here, so we can at least learn based on what the celebrities share in the headlines, so we can live our healthiest, happiest lives. And for those of you who are new to me, I am Dr. Frita. I'm an MD. I'm a medical doctor. I've been quadruple board certified. So I'm a board certified nephrologist, meaning I'm a kidney doctor and a high blood pressure doctor. I have also been board certified in internal medicine, pediatrics, and obesity medicine. So I like to talk about a lot. And right here on the YouTube channel, the Dr. Frita YouTube channel, we are up to over 880,000 subscribers. And so we're going to get there. We're getting to 900,000 and then to 1 million. So if you haven't already, please make sure you subscribe, hit the notification bell, and of course, give us a like. All right, it's time for my favorite little game, myth versus fact. So for this first myth versus fact statement, good folks in the chat, I want you to put an M1 if you think it's a myth, an F1 if you think it's a fact. And then wait, Shador, who was the first person in the chat?
First person today, Miss Aileen.
Hi, Miss Aileen. Welcome, welcome. All right, Miss Aileen, I'm going to see what you have to say. M1 if you think it's a myth, F1 if you think it's a fact. All right, what's that first statement, please, Shador?
You must have a heart attack before you need bypass surgery.
All right. Is that a myth? Put an M1. Or if that's a fact, Jack, put an F1. You must have a heart attack before you can have this major heart surgery, this bypass surgery. All right. Myth versus fact statement number 2.
Full recovery from major bypass surgery takes about a month.
Full recovery takes about a month. Put an M2 if you think this is a myth. Put an F2 if you think this is a fact. All right, pencils down, pencils down. All right, let's go to that first statement, Shador. What do we have? Do we have any takers?
Yes, you must have a heart attack before you need bypass surgery.
Okay.
I don't think you got him on this one, Dr. Frita.
What? Y'all know I like to trick y'all up a little bit.
It was in agreement, so we'll see what the
What
answer
they say?
is. Macy, hello,
Hi, Macy.
says a myth.
It's a myth. You don't think you have to have already had a heart attack, Macy? All right.
Paula,
Hi, Paula.
hi,
Welcome
says
back.
a myth as well.
A myth. You know what, Paula? All right.
Tisha agrees, a myth.
All right, Tisha.
Miss Aileen agrees as well.
You know what,
Says
Miss Aileen. Hi, Miss Aileen.
Oh, we got one that's going against the grain.
Who's going against the grain?
Tanya, she says a fact.
Tanya says that you have to have already had a heart attack before you get a bypass graft. All right. Anybody else?
No, ma'am.
All right. So in order to have a bypass graft, that cabbage, the open heart surgery, you must have already had a heart attack. This is a myth. It's a myth. It's a myth because the whole point in having this bypass graft is if you haven't had a heart attack, you want to prevent having a heart attack. And so if physicians see that you already have blocked or clogged arteries, then they won't sit there and wait for your heart muscle to pass away. They won't wait for you to have a heart attack. They will go ahead and do a graft if you have enough diseased arteries and you can have the bypass. We'll get into it. We'll get into it. All right. Thank y'all for your participation. Let's go to myth versus fact statement number 2.
Full recovery from major bypass surgery takes about a month.
All right. M2, if you think this is a myth. F2, if you think this is a fact.
All right. We do have a mixed bag on this one, Dr. Frita. I know you love a mixed bag. Ruby
I love a mixed bag.
Ruby says a fact.
It's a fact that recovery will take a month. She says it's a fact. Okay.
CJ agrees that it's a fact.
That it will take a month to recover and you can get up and go do what you got to do. Okay.
T Chosen, hello.
Hi, T Chosen.
Says a myth.
A myth. T Chosen thinks it takes longer than a month. Okay.
Angela agrees with T Chosen, a myth as well.
Angela and T Chosen. Y'all not sending me back to work after a month. Okay.
Como says a fact.
A fact that a month sounds pretty good. A month, 4 weeks. All right. Drum roll. Okay. Recovery, full recovery from open heart surgery, bypass surgery takes a month. This is a myth. It's a myth. It takes longer than that. Oh my goodness. And we'll talk about the procedure to really make you understand why it takes longer. Most people will not be released to go back to work any earlier than 6 weeks. And it really tends to take about 3 months. And I'll tell you why. It's actually quite an extensive surgery and we'll talk about it. So why I talk to you about, while I talk to you about coronary artery bypass grafting, the cabbage, I want you to put in the chat, what do you think are some reasons that people would qualify to have this open heart surgery cabbage? What are some of the reasons or causes that will cause someone to have this open heart surgery the way that Taylor Swift's dad had? All right. So the heart. Oh, that beautiful beating heart that we all have. We know that we have arteries that supply our heart, right? And if these arteries get blockage, if they get some type of plaques, if they get atherosclerosis, if they get cholesterol that's blocking them, then you no longer get the proper blood supply to the heart muscle and you can get death of the heart muscle, myocardial infarction, or a heart attack. Well, with a bypass graft, what happens is they will actually take a vessel from another part of your body, like your arm, your leg, even your chest, and they will create a bypass, almost like if you've ever been on the highway, and Lord help us for those who live in the Atlanta area like we do. If there is some type of a roadblock or an accident, you know how they will reroute you and kind of take you around another way. This is the same thing essentially that happens with a bypass graft. They'll leave that little blockage in there, but they'll take the end of a vein from another part of your body and they will hook it up in a way that bypasses or goes around the blockage. So here we have an image from the Cleveland Clinic, from an article from Cleveland Clinic. And you can see the different vessels on the heart. And what they have circled is that they're highlighting a portion of the heart artery or the coronary artery where there is a blockage. You see it's narrowed, so you can't get good blood flow from that. So what they've done is they've taken a vein from another part of the body, the saphenous vein, a vein that's in the leg is a very common one they use. They hook up one part of it to your aorta. You see that up top, kind of toward the right. the aorta, that big, huge artery, the largest artery in your body that really pumps all the blood everywhere. It sends some blood up to your brain, sends blood to the rest of your body. Well, they hook up the graft vein or the vein from another part of the body to the aorta, okay, where there's going to be a great blood supply. And then they bypass or they go around this part of the heart artery that's clogged. And then they hook up the other end of that graft vein. And so now what happens? You don't have to deal with that coronary artery. You get great blood flow to that previously blocked section. Now you have the good blood flow going straight from the aorta around the clogged artery and onto the other end of the coronary artery. So you have bypassed heart blockage with this coronary artery bypass graft. Okay. And so what happens is when you're going to your doctor, they look at different symptoms you might have. They work you up. They take a look and see if you have blockages. And if you have maybe just, a small blockage, then oftentimes there's procedures that can be done like angioplasty, where they can put literally a balloon type of an instrument into your heart artery and they can blow it up or dilate it. Okay, that can help you to get flow. Sometimes they'll put a stent in a heart artery. And this is kind of like a coffee straw, almost like a little straw to put it in there. And so that you have a nice flow that's going through the straw. What I'm describing with those are procedures that are not super invasive. Okay. They don't have to crack open your chest to do those procedures, but they can go through your groin or even through an artery in your wrist. And they're able to do angioplasty, or they're able to do stents if you only have maybe a small amount of blockage or a small number of vessels. When you start getting into situations where you have larger amounts of vessels, 3 vessels, 4 vessels, or in the case of Taylor Swift's dad, he had 5 vessels that had blockage. Well, then you need the open heart surgery, the CABG. And quite literally, they put you under general anesthesia, meaning they put you asleep. So you are asleep during the procedure and relaxed during the procedure. And they literally cut through your chest and cut through your sternum or your breastbone, open it up. Okay. And they kind of push your heart up in a way that they can do the surgery. Now, in some cases, they'll let your heart will continue to beat while they do the surgeries. But in a lot of cases, they literally will put you on a heart lung bypass machine, meaning if your heart's not working during the surgery, what's going to happen? Okay, you're going to say toodaloo, you'll shake out of here. So then while they're doing surgery on your heart, if they have to stop your heart completely, this bypass machine they use, this heart lung bypass, will allow your blood to leave your heart, leave your body, get some oxygen from the machine, get carbon dioxide taken out of it by the machine, and then that machine will give good, clean, oxygenated blood back to your body. It's pretty cool. But bottom line, that procedure that we showed with the graphic before, they can do that bypass while you are asleep. And in Taylor Swift's dad's case, they did it with 5 different arteries. So prayerfully, he will heal well. We know that heart disease is the #1 cause of people not being alive in the United States. And so it's actually a rather common procedure, like 200,000 per year are done. Now, what actually leads someone to needing a CABG? Do we have any takers? What are some causes or symptoms that will lead someone to having open heart surgery?
Yes, ma'am. Angela says blockage.
Absolutely. So blockage of vessels. And as we discussed, sometimes if you just have 1 vessel, maybe 2 vessels blocked, you can get a procedure that's not super invasive. But in this case, like when he had 5 vessels blocked, that's definitely a cause. So coronary artery disease is that big #1 cause. Very good.
Yeah, and Paula said clogged arteries.
Absolutely. Clogged arteries, blocked arteries, stenosed arteries, all of that is going to lead to, that's one of the major causes of needing a CABG. Good. All right. Anyone else?
Those are the symptoms. T shows, I guess. Macy's China says diabetes.
Diabetes is a leading risk factor for heart disease. So if you have diabetes, that will definitely put you at a higher risk of having the clogged arteries. But the diabetes in and of itself is not the cause. I guess indirectly, the diabetes could be the cause of you getting clogged arteries, which then the clogged arteries would be the cause that will lead you to needing a bypass surgery. Yeah.
Aileen says problem with the valves.
Problem with the valves. So, that's a tricky one. So specifically in talking about coronary artery bypass graft, that is a type of open heart surgery. That one is strictly dealing with the vessels and a few other reasons. When you're talking about heart valves, like if you have a stiff aortic valve, for example, or aortic stenosis, or if you have a leaky mitral valve and the different valves of the heart, you may need open heart surgery but it's different from the bypass graft surgery. So what I described and the heart being cracked open and all of that, or the chest being open, yes, you might need those things for valve surgery, heart valve surgery, but that's not necessarily heart grafting. So yeah, valve can be a cause that leads to open heart surgery, but it's a different type of open heart surgery than the bypass graft. Thank you for that. So I can make that distinction.
I remember Ms. Rosalind. Hello.
Thank you for being a member, Ms. Rosalind. Welcome, welcome.
She says arrhythmia.
Oh, I'm glad you said that. So listen, one of the causes, oh gosh, arrhythmia is interesting. One of the complications of having a bypass graft, one of the complications is a heart arrhythmia, meaning that your heart, instead of beating like ba-boom, ba-boom, ba-boom. Y'all like my little demonstration there? Instead of your heart beating like that, if it's having some type of an erratic or regular beat, boom, 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 that's an arrhythmia. And one of the big complications of having open heart surgery, specifically the bypass graft, is an arrhythmia can be a complication, specifically AFib or atrial fibrillation. Now, as far as the arrhythmia being the cause, not the direct cause necessarily, but listen, if you have severe angina, meaning chest pain on exertion. So even if you have not actually had a heart attack, if you're getting severe or persistent angina or chest pain, that in and of itself could lead to you needing a bypass graft, certainly if you have blockages. Yeah. But the arrhythmia all by itself in a vacuum won't be the cause. But if you're having heart disease has led to you having arrhythmias, it still gets back to the heart artery blockage. It all goes back to heart artery blockage. Good.
Yeah, absolutely. And Planet Life, Dr. Frita, hypertension.
Planet Life. Hypertension. Again, we're talking just like diabetes. Hypertension is a leading risk factor for heart disease. Okay. And certainly there's a correlation with people with high blood pressure and with blocked arteries. So yes, indirectly, this is one of the causes that can lead up to it, but all roads lead to heart artery blockage. Good.
All right. And Macy says bad cholesterol.
Very good. Having bad cholesterol can lead to the cholesterol plaques, right, Macy? So yes, cholesterol can lead to cholesterol plaques that get in your heart vessels, combined with platelets getting stuck, calcium deposits being stuck. So that high cholesterol can lead to blocked arteries. All roads lead to blocked arteries. Yes, but that's one of the causes that can lead to it. Just like diabetes and high blood pressure are risk factors, cholesterol is a real big one. Very good. I like y'all participating today. I appreciate it. And remember, for high blood pressure, as we mentioned, it's a leading cause. I do have a book, Under Pressure, A Guide to Controlling High Blood Pressure. You can click the link here or go to my one-stop shop, drfrita.com, where I talk about the management of high blood pressure, not just with medicines, but also holistic, natural ways to treat it, using food as medicine, exercise as medicine, slow, deep breathing as medicine, certain supplements as medicine. So make sure you check out that book to manage hypertension so that you can decrease your risk factors and try to prevent yourself from needing to have that open heart surgery that Taylor Swift's dad had. All right. That's good, good, good. All right. I love it when y'all participate. Let's see if y'all participate with this next segment. All right. Please go ahead. Be sure to hit that like button, share, subscribe, and let's talk about a topic that has been in the headlines all weekend, Shador. Trump has big ankles. He has swollen ankles. This has been a headline. And he has had a diagnosis of med heads. Any of y'all know what Trump's diagnosis is that they say is the cause of his biggest? And I'll be really impressed. They say he has a certain diagnosis that's causing him to have swollen ankles and a little discoloration in his ankles. Anybody know the diagnosis?
So waiting on them to chime in, Dr. Frita. Shout out to Andrea, our member.
Hi, welcome back. Thank you for being a member, Miss Andrea. Thank you. All right. Well, I will tell you what his diagnosis is unless someone chimes in. But the diagnosis he has led to him having swollen ankles or edematous, water-filled ankles. And it's a diagnosis that occurs when the valves in your veins aren't working properly. Okay, so we all have arteries which take good oxygen-filled blood away from the heart, and it supplies our bodies all the way from our top of our heads to the soles of our feet. And then that blood, once the oxygen has been taken away from it by our tissues, that blood gets returned to the heart by your veins. The thing is, your veins have these valves in them. And if those valves don't work properly, then the blood won't be pumped back to your heart properly, and you can get a backup of the blood, leading to swelling, leading to varicose veins, leading sometimes to discoloration. And this condition is called, do we have any takers?
We got a couple takers out
there. Oh, who we got? Come on. Are y'all gonna be in the front of the class? What's gonna happen?
So we have 2 takers on this one. Choctaw Girl.
Hey, Choctaw Girl.
And Be the One.
Be the One.
Yes.
I know that's right. Hi.
Says venous insufficiency, or more specifically, chronic venous insufficiency.
You come on to the front of the class. Choctaw. Was Choctaw 1 and Be the One?
Choctaw Girl and Be the One.
Choctaw Girl and Be the One. Come to the front of the class. You're absolutely right. The condition is called chronic venous insufficiency. And I've had so many people, Shador, who have been asking me, oh my gosh, he's got chronic venous insufficiency. Does that mean he's not going to be alive? Is he going to pass away? The answer is no. Okay, the answer is no. This is a pretty benign condition, very common condition. And again, it's when those veins that are supposed to be pumping your blood back to, returning your blood back to the heart, the valves don't work, you get a backup, and you get swollen ankles, swollen feet. There are different stages. With stage 0 of chronic venous insufficiency, or CVI, there's really no visible or touchable, palpable signs, but the person who has it might feel tired legs. If by the time they get to stage 1, then they can start having little like spider veins or telangiectasias, little spider veins in the leg. By the time they get to stage 2, they can get straight up varicose veins, which y'all have seen varicose veins. Y'all know what varicose veins are, like a swelling of veins that's at least 3 millimeters wide, varicose veins. By the time you get to stage 3, you also get swelling or edema. So we know that Trump is at least at stage 3 of his chronic venous insufficiency. And then it can progress to where you outright get discoloration, hardened skin, darkened skin, and you can even get healed ulcers for stage 5, or for stage 6, open ulcers, okay, from the venous insufficiency. So it's very common, typically not life-threatening. About 1 out of 20 people have it. And for adults, especially those who are over the age of 70, it's a much greater percent, approaching closer to 50%. So it's pretty common. And the biggest risk factor, or one of the large risk factors, is just being older. And he's 79 years old, which is something, because he spent a lot of time, Trump did, talking about, President Biden for being old, saying they need to put a shot in his behind to get him out of the basement. Like, President Biden being old was a big jab from Trump, but Trump's illness that he has right now, this chronic venous insufficiency, is largely because of his age. Another big risk factor, blood clots, or DVTs, okay, deep venous thrombosis. Now, his team did say that he doesn't have any active blood clots, but I'm going to tell you this. Blood clots are a huge risk factor for chronic venous insufficiency. And it would be interesting, you can play word games too, because I know I have patients who have chronic venous insufficiency and they have had blood clots in the past. And so if I were to stand before the people, if HIPAA weren't in effect, and say, my patient does not have a blood clot, we have checked, she just has chronic venous insufficiency, I could say that and be telling the truth, but I also could be hiding from you that she had blood clots in the past, okay? And so, but blood clots are a big risk factor. According to his, administration, they say that he does not have any active blood clots. The other interesting thing with Trump's health that we saw, he had some discoloration, looking like bruising in his hands. And he talks about all the handshaking that he does. His team said that it's because he's been on aspirin, okay, as a blood thinner, as a precaution to prevent heart disease. And with all of his handshaking, that's caused him to be bruised. That is a possibility. And so that is the deal with the varicose veins, with Trump's health. And I want you all to tell me what kinds of, first of all, had any of y'all heard of chronic venous insufficiency? Other than that, 2 med heads who came to the front of the class, Choctaw Girl and Be the One, had anyone else heard of chronic venous insufficiency before President Trump declared that he had it? And were you thinking, when you heard that long name, that it could be really just a serious illness? So y'all can go ahead and put that in the chat. Also, if you've experienced it, now that I described what it was, if you want to share your own stories or any loved one's stories that you're like, oh my gosh, this is actually chronic venous insufficiency that I have, you can go ahead and share that in the chat. Meanwhile, if we don't have any takers right now, Shador, then we will move on to our next story.
All right. Yeah. The majority are saying no, they have not heard of it. So
yeah. Okay. Yeah. It sounds. Yeah.
Yeah. Angela says she thinks she has it. Yes, I've heard of it. I think I have it.
Well, 1 in 20 adults have it, and the growner you are, the more likely you are to have it. And so a lot of people, look, even young people in their 20s might look and see those little veins that look like spider webs, little spider veins, like they're purplish or reddish. And that, if you have those, that's a level, stage 1 of chronic venous insufficiency. Again, 1 in 20 adults will have it, and it's super, super common. There are lots of treatments for it. There can be vein ablation. There can be stripping of the veins. There can be, cutting or ligation of the veins. Pretty benign treatments. But honestly, if you wear compression tights, and if it's something that's not real bothersome to you, then a lot of people don't get surgery. They just put on their compression stockings, or Ted's hose, and try to elevate their feet, not be on their feet too long. If you're someone who's on your feet all day and you have swelling by the end of the day, then certainly that could put you at risk for progressing in chronic venous insufficiency. Yeah, it's pretty common. Sounds like a big, huge, serious term, but not life-threatening. Not.
Yeah. Jan, hi Jan. Jan shared that her husband has it, runs in his family. Sonogram shows muscle function, but he's too lazy to walk.
Oh, I know you didn't talk about your husband like that. I hope he's watching. Yeah, but you really said a word. Thank you for sharing, because listen, oh gosh, you made me think about something. So I talked about arteries leaving the heart, right, with the good oxygenated blood, and then veins bringing blood back to the heart with the blood that needs to get oxygen. Well, with your arteries are actually pretty muscular, okay? And so they're able to kind of pump, contract, and get blood out the way it needs to be gotten out. But the veins depend on your muscles, the contraction of your muscles to work properly. That's why for people who will sit in the airplane for a prolonged period of time and take a long flight, 5-hour flight, 16-hour flight, they're at risk for getting blood clots, because if you're not moving, walking, pumping, contracting the muscles in your legs, then the blood is more likely to pool and just sit there in the veins. The veins depend on muscle contractions, and they depend on valves that work well. And so you got on here and called your husband lazy. I hope he gets up and walks, because what you're saying is true as far as if you walk and make sure those muscles are pumping and contracting, that is a way to help to prevent or to decrease the symptoms of chronic venous insufficiency. Thank you for bringing that up.
Mm-hmm.
All right.
Lisa shared, Dr. Frita.
Lisa.
Lisa says, yes, she's heard of it. They thought I had that, but it turns out I have May-Thurner syndrome. I just had a stent placement.
Oh my gosh. Very interesting. All right. Well, thank you for sharing. So, and so I'm assuming that in that syndrome, you probably had some of the similar symptoms, including swelling. Did anyone else put any more of the symptoms of chronic venous insufficiency in general?
No symptoms, but Planet Life said sclerotherapy could treat it.
Okay. Yes. Oh gosh. And the treatments they're not super invasive, and they are very effective. And so you probably have seen some of these like commercials for vein clinics. And so they're not calling it chronic venous insufficiency, but if you're dealing with varicose veins, that's what it is. And remember, the varicose veins are these swollen veins that can be visible, usually in your legs, that are at least 3 millimeters wide, bulging from the skin. And so they do treatments such as that. Mm-hmm. Very good. All right. Yeah. Super common. President Trump has it, look over there. It sounds really serious. It's not. And so, and it's interesting. I remember he called himself the healthiest president in the history of presidents. And I know, at least for his first term, that poor little doctor gave a report. This is the most, incredibly healthy, vibrant man, all these exaggerated, these superlatives, all of these descriptors and adjectives. And if you follow politics, like y'all know I do, and you look at Trump's height versus his weight, what he reports as his height and his weight, if you know anybody in real life, which of course all we do in the office is take heights and weights, he does not at least look to be as small as the weight that he is claiming to be. He looks to be living with obesity. I say that to say this administration is not always super transparent. And so he's saying that he has this big, long name of an illness that's actually pretty benign. I'm always looking at the side eye and wondering if there's something more. So we'll see. We'll keep you posted here for sure. All right. Please go ahead and give us a like as we move into this next topic. Now we're talking about Lupita Nyong'o. Okay. Y'all know her, Oscar award-winning actor. She's been in Black Panther. She's been in Us. That scared me, Shador. I don't even like horror movies like that. It's more of a kind of a sci-fi movie, but y'all know my oldest daughter who is, a broadcast journalism scholar at FAMU, and she wants to be a filmmaker, director. She loves horror movies. She will sit there with a straight face. Well, I'll be sitting in the corner screaming and calling on Jesus. Anyway, but Lupita was in that one. And there was another one. Y'all put in the chat if y'all know this other one. Is it called The Others? Shoot. It was the most recent one, and it was scary also. It was like one of those dystopian end of the world movies. She was like a cancer survivor, and she was like in a movie theater, and the world was coming to an end. Y'all put in the chat if y'all know the movie I'm talking about. She's very good, but I'd be in there shaking in my boots trying to keep up with these horror movies. What is it? Anybody know the name of it? Did you
so Angela says them. Macy says us.
Us, yeah. Us was definitely one I saw. She was in another one too, where she was actually ill, like she had cancer. It was like maybe 2 years ago. I don't know, but I was scared. And then, of course, 12 Years a Slave and Black Panthers, and one I think that really kind of crossed over and had a lot of people into her. Just great actor. So we know all those things about her. But right after she won her Academy Award, 2015, that same year, she was diagnosed with fibroids. So now she's, excited to be bringing about awareness. She's partnered with some nonprofits. Let's play this clip and let's talk about fibroids. And the question I want to pose to you, good med heads, is we're hearing a lot of talk about women and female issues. Do you believe that women are taught to suck it up and to suffer when it comes to pain and illnesses? Or do you think that we're just being a bunch of crybabies? Do you think that we're conditioned to suck it up and take it? And when it comes to things like fibroids that cause a lot of symptoms, are we just taught being a woman means having monthly pain? Deal with it. What do you think? All right, let's play this clip, please.
Lupita Nyong'o is getting candid about her health. After spending more than a decade admittedly suffering in silence, the Oscar winner opened up about her struggles with uterine fibroids, non-cancerous growths that develop in or around the uterus. Lupita began in a July 15th Instagram post. In March 2014, I won an Academy Award. That same year, I discovered that I had uterine fibroids, 30 fibroids. I had surgery to remove them. I asked my doctor if I could do anything to prevent them from recurring. She said, "You can't. It's only a matter of time until they grow again." The 42-year-old said she did not realize that the condition affects so many women until she started talking about her experience privately with her inner circle. Lupita shared, "When we reach puberty, we're taught periods mean pain, and that pain is simply part of being a woman. We're struggling alone with something that affects most of us." She continued, "We need to stop treating this massive issue like a series of unfortunate coincidences. We must reject the normalization of female pain." That's why the Black Panther actress said that she's working with U.S. Congresswomen to introduce a package of bills that will expand research funding, increase early detection and interventions for uterine fibroids, study the causes of uterine cancer, and increase public awareness. She wrote, "I envision a future with early education for teenagers, better screening protocols, robust prevention research, and less invasive treatments for uterine fibroids. Let's study women's health and prioritize this chronic condition that has never been comprehensively examined." Lupita added, "We deserve better. It's time to demand it. Silence serves no one. Uterine fibroids can develop in all women of reproductive age, but Black women are more likely to have fibroids than are people of other racial groups, according to the Mayo Clinic. While many uterine fibroids don't have any symptoms, complications can arise and cause heavy and painful periods, pelvis pressure, urination problems, infertility, and pregnancy loss."
Yeah, I'm really excited that she's not only sharing her story, but that Lupita Nyong'o is taking action when it comes to it. And again, it is showing we see that she's come forward. And for those of you who missed last week's and the week before, actually, we touched on it. We did talk about Venus Williams and her story with fibroids. And there's a lot of similarities, where they just didn't kind of know how common they were. In Venus's case, she felt like she was dismissed and just kind of being taught to suck it up and deal with the pain. So it sounds like it was 2014 when she won the Oscar, and she also, learned about her fibroids, and she had 30. Okay. That's not a small amount, but imagine not knowing that these things were really actually treatable. Okay. Treatable, but just kind of sucking it up and just being left in debilitating pain basically every single month. Did anyone comment? Do you think that women have been conditioned to just like, hey, be a real one? You're a woman, this is what we have to go through. Anyone comment on that?
Yes, okay. I did comment. CJ says, yes, we're taught to suck it up.
Yep. It's true. It's true. And sometimes people can be pretty insensitive about it, because you can get, debilitating pain to the point where how are you supposed to take a test, like a teenager in school, or how are you supposed to participate in sports? You have to. But if more women knew that there were treatment options, even, for young girls who have it, I know that at least when I was growing up, there was a huge stigma behind like hormones or birth control, because it was assumed if you were a high schooler or even a middle schooler on birth control, she must be, sexually active. She must be fast, all this kind of stuff. And so a lot of parents would not want their children to be on birth control or hormones when that's one of the ways to help to decrease the severity of fibroid pain, if you don't want to go so far as to have any kind of procedure, for a teenage child. And so there was just a normalization of suck it up, take ibuprofen, go lay down. But when it's time for this test to go to school, you still have to go. You're taught to just kind of suck it up. You're a woman, blame it on Eve. Anyone else?
Yeah, I remember Ms. Rosalind shared two parts to it.
Okay.
She said, I'm not going to deal with pain. I need to see why I'm hurting. And then after I see what's happening, then I will suck it up.
Oh my gosh. So you're not going to just put a Band-Aid on the pain or just sit there and suffer. You're going to find out what's going on. I know that's right.
Find out why, then she'll suck it up if it continues.
Suck it up if it's continued. But the way that, hey, this is 2025. We really don't have to suck it up. But what we do have to do is take away the normalization of women suffering, and again, we do know that by the time women are 50, up to 80% of us will have had fibroids. Fibroids are considered common in women in general, but they are more common in Black women. Okay, they are more common in Black women. Make sure that after we finish this live, you check out the video that I did, and you can just put right here on the YouTube channel. You can put Dr. Frita, Venous Williams, or Dr. Frita fibroids, and you'll see where I talk about, fibroids and 7 things that you need to know about them. But they are common. And if you are a woman, if you're living with fibroids, if you're having some of the symptoms like heavy bleeding, really bad menstrual pains, having some fertility issues, things of that nature, talk to your doctor. There are treatments beyond hysterectomy. You don't have to automatically have your uterus surgically removed. You can have a myomectomy where they just remove the fibroids themselves. You can even have something that's non-surgical, okay, that's non-invasive, the uterine fibroid embolization, and that's a radiology procedure. So yeah, check out last week's live. We talk about it, but there are options. If you're not happy with the options presented to you by your physician, get a second opinion. That is your right to be heard. All right. Anyone else as we get ready to move on to our next topic?
Yes.
Oh.
T Chosen and I think T Chosen and another one had the same view. I read both comments.
Okay.
T Chosen says, yes, especially Black women and brown women, symptoms are dismissed with a let's wait and see treatment.
Absolutely. Absolutely. And this is not even just an opinion, T Chosen. This is actually studied. There are a lot of implicit biases, okay, implicit bias, or people assuming that Black women can handle pain, okay? Mm-hmm. And so there is a big suck it up approach that's been found systematically in studies, specifically disproportionately affecting Black women, okay? Oh, you're having pain? Oh, you know what? That's a part of life, That's just what happens once a month. Yeah. Just keep seeing how the symptoms are and come back to me. A lot of dismissal, specifically with Black women. Yep. And I'm glad that people like, Venous Williams, Lupita Nyong'o, they're coming out and they're saying it, because it's not even just about money. There are racial disparities, even when you have high affluence and financial access. Thank you, T Chosen.
Yeah, and that's Tisha was echoing that. She said we are taught to suck it up. When we reach out about our pain, we are dismissed. So just
absolutely.
Our brown Black ladies.
And I remember some girls who didn't want to participate in sports or in PE, and the teachers would just be looking at them like, even female teachers would look at them like, child, she need to just get it together, and then looking back, those girls could have had, yes, PMS, they could have had fibroids even as teenagers. And so, yeah, women are oftentimes dismissed. But again, I'm glad that we have people who are in the forefront, celebrities who are using their platforms for the good. All right. I love it. So these are some women using their platforms for the good. But guess what? We have a man who's using his platform for the good. We have a man who is a bodybuilding icon who won Mr. Olympia 8 times. And he's sharing that he had sepsis, okay, almost passed away from it. And he believes that his life was saved by his 13-year-old daughter. Let's run that clip, please, Shador.
Yes.
What's up, everybody? It's your boy, Big Ron here. And man, let me tell you, these past few weeks have been some of the toughest of my life. The boy was hit with sepsis, and it nearly killed me. Had it not been for my 13-year-old daughter, it probably would have. And y'all know me. I've been faced with some battles in my life, but nothing like this. I'm still here because the grace of God still wants me to be here. And the support I get from all of y'all, that all helps out a whole lot. Now, I kind of feel a little responsibility to use my platform to raise some awareness to this thing we call sepsis. Because, like me, people don't even know what sepsis is until it's too late.
Okay, that's good. All right. So he's there, he's sharing. He's only 61 years old, and his speech is a little slow. Clearly he's, expressing himself well. And again, I love it when celebrities use their platforms to help us to live our healthiest, happiest lives. So Ronnie Coleman, again, he won Mr. Olympia 8 times. He was a super, bodybuilding icon. So y'all see him now after he's getting over illness, but this is what he was looking like when he was winning all of those awards. Okay. Bodybuilding icon. And it's another one of these things that shows us that illness does not pick and choose. It can happen to celebrities, happen to people with wealth, happen to people whose bodies are in the ultimate shape, such as in this photos. A time can come where you can be susceptible and you can develop sepsis. And so I want you all to put in the chat, if you're familiar, what are some of the signs and symptoms of sepsis? Meanwhile, I'll go ahead and talk about what sepsis is and what he was about to get into. So sepsis occurs when you have an infection, okay, an overwhelming infection, and your body's reaction to the infection is really disproportionate and extreme, and it can lead to you having multi-organ failure, and it can even lead to you not being alive. Okay. And so things that can cause sepsis, infection. So it can be bacterial infection, infection with a fungus, viral infection. And your body is supposed to react, right? Your immune system, it sends out all types of inflammatory cells, cytokines, chemical reactions. But if that reaction is extreme, it can cause all kinds of signs and symptoms, which I'm going to ask you guys, that can lead you into the ICU and even lead you into not being alive. And so first, in order to treat sepsis, one has to recognize that they're sick enough to go to the hospital. Or if sepsis gets you to the point where you are confused or have altered mental status, or if you've passed out, then you will need someone else to recognize it and call 911. And it sounds like in his case, his daughter was the one who recognized it, because once you get to the hospital, and if you really do have septic shock, which is when that overwhelming infection has gotten to the point where you need support for the different systems in your body, like your blood pressure, your heart, different things of that nature, then you'll need to go to the ICU if you have septic shock or overwhelming sepsis. So y'all talked about the causes, infection, and the reaction from your immune system being out of whack. Did anyone give me any signs and symptoms of sepsis or septic shock?
Absolutely.
All right. Oh, I love y'all med heads. Yay. I'm gonna give y'all a like, and I want y'all to give me a like on this on our live, and share it, please. Let YouTube know we're here.
Ms. Rosalind says temperature in the body.
Okay, good. So it can go both ways, Ms. Rosalind. You can have high fever, okay? So over 38 degrees Celsius or over 100.4 degrees, but we're more talking like 103 degrees, 104 degrees, or low temperature, hypothermia can also be a sign of sepsis. So good. Temperature in the body, high or low. Mm-hmm. All right.
Macy says headache.
Yes, you can get a headache for different reasons. Oftentimes when you're having sepsis, specifically septic shock, your blood pressure can drop. Okay, you can get low blood pressure. And if that happens, then sometimes you can get a headache. So your headaches can happen with low blood pressure or your body's dehydration or perceived dehydration. Headaches can also happen with very high blood pressure. Good.
Planet Life says fever and vomiting.
Very good. Fever and yes, vomiting, nausea, vomiting can be a sign of overwhelming infection as well. Good.
Ms. Rosalind added sweating.
Yes. So you can get sweating or diaphoresis, and you can have really cold, kind of clammy skin if you have sepsis or septic shock. And another thing with that, Ms. Rosalind, is sometimes your blood sugar levels are dysregulated. Your blood sugar levels are out, or your glucose. And if you have blood sugar that drops during septic shock, then that's another one of those things that can make you jittery and give you sweating or diaphoresis. That's a good one.
Ms. Paula says you can have a toothache, and if it goes into your bloodstream, you can become septic.
Say it. Come on to the front of the class. Say it. And that's why we are so serious when it comes to you going to the dentist. And I really wish that as a whole, we had better dental care in the United States. That's a whole nother thing. Because if you have a cavity and say you don't have dental insurance and you really can't afford it, you're like, I'm gonna leave it alone. And that cavity, progresses and it goes into an abscess or like a dental infection, that can lead, number one, it can lead to a brain abscess or a brain infection, and it can lead to sepsis. Yes, something as simple as dental caries or dental infection can lead to that. Usually it's bacteria. Y'all, the human mouth is not clean. I'm not trying to be, it's just, there's a lot of bacteria. Like I want y'all to look it up after you finish this live, getting a dog bite versus getting a human bite. Or like if someone, if you punch somebody in the mouth, look, we don't promote violence, but if there's a punch and then human teeth cause a cut in someone's hand, baby, Google bacteria in a human's mouth versus bacteria in a dog's mouth. So there's a lot of bacteria in our mouths. So we all please floss, please brush. Please, hello, Serene Dentistry, to my cousin, Dr. Keisha McCrae Andrews. Take care of your teeth. But yeah, that's a good one. The teeth are a source of potential infection and potential sepsis. No joke.
T Chosen added slow breathing and confusion.
Very good. Okay. And so then I haven't heard him get into these details, Ronnie Coleman. I do know that he's has a foundation, Ronnie Strong. So y'all can look that up, where it looks like he's trying to bring about awareness to sepsis. But yeah, I'm imagining if someone else had to save him, he probably had altered mental status or confusion. And you mentioned the slow breathing. Again, the breathing can go either way. Sometimes you'll have rapid breathing or tachypnea. Okay. If you have infection, especially if you have pneumonia, but then if you have, if your body has progressed and things are starting to get suppressed, then you could have slow, shallow breathing. Okay. But respiratory failure is a part of that multi-organ failure I was talking about that septic shock can lead to. So brain failure, as far as confusion or altered mental status, your neurological system affected. You can have a cardiovascular failure where you can't maintain a normal blood pressure drops. You have very low blood pressure, and you have to be on what they call vasopressors, which are medicines that help to keep your blood vessels tight or constricted so you can have a good blood pressure. You can have kidney failure for sure. And oh my gosh, over the years, I've had to put so many patients on dialysis because of septic shock. And what's tricky is that if you have septic shock and you don't have a good blood pressure, then you can't tolerate a regular dialysis. You have to be on a special dialysis that we do in the ICU that won't cause your blood pressure to drop. And you're on that dialysis around the clock, 24 hours a day. And it's very intensive. It's very serious. So yeah, you can get lung failure or respiratory failure requiring a breathing tube down your throat or intubation. So yeah, so those are good med heads. Y'all coming to the front of the class. Very good. Very good.
I got a couple more, Dr. Fisher.
Well, keep it coming in.
VE, hello.
Hi, VE.
VE says she had a friend who was misdiagnosed as recovering from surgery, but as it turned out, she had sepsis, unfortunately, due to the misdiagnosis. She is no longer with us, and she had a complaint of back pain and difficulty breathing.
Oh, I'm sorry to hear that. I'm very sorry to hear that.
Yeah.
And I thank you for sharing, Ms. VE, because again, I definitely think that, overall, as far as medical care is concerned, yes, I have an issue with, medical care access in the United States, but as far as medical care and research and our ability to give good care, hey, we're top notch here in the United States. But you still have to be your own advocate. You still have to ask questions. And if you don't share stories like that, Ms. V.E. Hall, then people might sometimes just listen to their loved one complain, and the doctor might say, oh, everything's okay. But now in listening to you, they'll be able to understand that if someone's having a complaint that's persistent, you don't just stop just because the doctor automatically says it's okay. Continue to ask questions if you're still concerned. Get a second opinion. Request a second opinion. Don't worry about rocking the boat. You want to be your own advocate or your loved one's advocate. So I'm sorry that she had that. I'm really sorry that she passed away.
Absolutely. Paula.
Hey, Paula.
Says, toxic shock from leaving in a tampon too long.
Ooh, that's a real thing. That's a real thing. Toxic shock syndrome. And it's something that's much less common now, but at least in the absorbent tampons, the way that they were made in times gone past, it's still possible to get it. It's just less common now. If women, females, people who, had menstruations, left tampons in for too long, they could get a certain bacteria that can release toxins and lead to toxic shock syndrome. And that is something that could cause a septic shock. So for anyone who is menstruating, wearing tampons, please don't try to cut corners. Please don't try to save money. Please don't say, oh gosh, I'm running in here to use the restroom, but I just had this tampon in only for 30 minutes. I'm not changing it. Change it. Change them frequently. Follow the instructions that are on the tampons, consult with your doctor, because it still is a possibility, toxic shock syndrome. Oh, you took me back. You took me back to medical school 101. We were learning about that. Very good. But yeah, that's a cause.
Absolutely. And then I remember Dr. Frita chimed in, Ms. Pauline. Hey,
Thank you. And listen, for those of you listening, if you want to be a member, listen, you don't have to miss the party. There's a tardy. Oh, don't be tardy listen, you can join our membership. We have a great time. You have access to members only live Q&As. And that's where once a month, instead of me doing all the health topics and going here and going there, I just go to you, where you come on and we talk for the entire time, where you can ask me questions. Remember, I shared about my different board certifications, nephrology, internal medicine, pediatrics, obesity medicine. I read health articles every single day of the week. I'm not even exaggerating. It's fun for me. And so if you would like to have access to my knowledge, then I can listen to you and share medical information in our members only live Q&As. Plus I pop on there and just give you some members only videos. I just did one. What was that? Oh, last week. Anyway, I have one that's on there for you members. And so once you join that certain tier, you have access to all of them. And then for those of you who would like to do a one-on-one consultation with me, I do offer a telehealth concierge service where you can bring me your issue, maybe get a second opinion. I take a history and you have privy to my medical information, just one-on-one. I can talk to you from anywhere in the world. And that's a lot of fun. Oh, shoot, Shador, I know we have some concierge telehealth appointments today also. So let me keep on moving. All right.
Ms. Pauline's comment. She says organ dysfunction and skin discoloration.
Absolutely. So like in some of the cases, like with the toxic shock syndrome, you might get like a reddened skin, right? In general, with septic shock, you might get a cold, clammy, pale looking skin, a skin that's pale to your regular color. And what you said, organ dysfunction, absolutely. You can get a multi-organ failure, as we've described. Yeah.
All right. Is there a prevention, Dr. Frita?
The only prevention would be not getting an overwhelming infection. So just in our everyday lives, as far as hand washing, making sure that we eat food that's not expired. We don't eat mayonnaise products that have been left out too long. If you have a sore or, a cut, making sure you tend to it so that it's clean, that it's covered when it needs to be covered, that it has bacterial supplies on it. If you have listen to your body. If you have a bladder infection, don't just ignore it and wait for it to go away, because a bladder infection can lead to a kidney infection or pyelonephritis that can do it. So just the main way of preventing it is to try your best to prevent getting sick or getting an infection. Of course, we can't always do that. So then the next tier is to recognize when you're starting to get an overwhelming infection. If you have a super high fever, if you're having chills, if you're having fever, if you're having diaphoresis, instead of just sitting at home, call your doctor, go to the ER, go to urgent care, because physicians will be able to know what's just a little, early infection, and they can cut it off perhaps with some antibiotics, antivirals, antifungal medications, versus, oh no, you need to come to the hospital. So mainly being in tune and doing things like you're doing now, educating yourself about various health conditions like you're doing here on the Dr. Frita Medical Monday, and becoming your own advocate and advocate for your loved ones. Good question.
All right. Thank you, Dr. Frita.
All right. Shall we move on?
Yes.
All right. Serena Williams has been in the headlines because she has had a dramatic weight transformation. So please go ahead and give us a like, a share, and subscribe as we get into this story. We know that Serena's body has been under scrutiny for decades at this point, right? She's really had to take really actually quite a bit of verbal and emotional abuse from the public. She's always been very muscular. Even when she was a young teenager, they've said, oh, she's built like a man. Oh, she's too muscular. Oh, she's big. There've been so many just cruel jokes at her expense over the years, right? Well, now she's not big. And she doesn't look particularly muscular, although I know she's very fit. She's showing some pictures on the internet of her in the gym, and she's quite thin, which was never her body type. And people are giving her mixed reviews. People always have something to say. But anyway, they're giving her mixed reviews. And so we'll play this clip, and then I want you to tell me, do you support Serena in her weight loss and her body transformation? And that's her business. If this is what makes her happy or healthy, go for it. Or are you concerned? Do you think that it's showing some hidden poor or low self-esteem? Is she trying to get away from the body she was born with? Is she getting away from the historically black shape, black figure? Is it a sign of self-shame? I want to know what your opinion is on Serena Williams' transformation. Let's go ahead and play this clip, please.
Serena Williams is just that girl. The tennis champion takes to Instagram July 11th to share a series of gym selfies with her abs on full display. In the pics, she shows off her toned physique in a black sports bra and leggings, captioning the pic, "Working out and working on my angles." And when Serena's not hitting the gym, she's busy with her 7-year-old daughter Olympia, who she shares with her husband of 7 years, Alex Ohanian. She even recently shared a totally relatable mom moment when she confessed to needing a quick break from parenting. Serena wrote on X back in April, "I'm in my car, my Navigator to be exact. I've got the massage seats on. I'm sadly hiding from my kid." The 43-year-old, who also shares 20-month-old daughter Adira with Alexis, had been on mom duty all day since. As she noted, "Today is a holiday and no school." And Serena had no regrets about admitting to sneaking away from her little one. In fact, she was prepared to take on any criticism she might receive for the confession by adding, "Judge away, I don't care, I need 10 minutes." In an interview with Vogue in 2022, the athlete shared she's confident in her parenting skills. She said, "I'm a wonderful mom. I think we as women don't give ourselves credit, but I'm a great mom. I really am. I do everything. I'm freaking the room mom at Olympia's school."
Very good. And Shador, and I don't know if you might be able to find it. There have been different photos of the before and the after of Serena, just still shots. If you're able to find that and put it up, please do. If not, folks will be able to Google that after this live, where it's really dramatic on how thin she is. She definitely does not look bad. Okay. She's still muscular. It's just completely different. Sometimes people, will have babies, have mommy weight, postpartum weight, things of that nature, or after they've been athletes, they'll gain, extra weight, like, adipose tissue, fat weight. But then once they lose the weight, you're like, okay, yeah, that's how she used to look, when she was an athlete. But Serena right now is thinner than she ever was. Because again, as a teenager, that just wasn't her body type. She had a slim waist, muscular legs, muscular bottom. Yeah, she was just, yeah. So it's dramatic. And so I'm curious if anyone chimed in. Do all of us need to just mind our own business? Is this a sign of something worrisome? Is it a body dysmorphic issue? Or is she just being healthy? And now that she's a post athlete and not, working out as much as she has, does she need to just, do some different things in order not to get unhealthy fat weight? Any comments on Serena and how she looks?
Yes, we do have a few comments. Okay. Flora on Facebook. Hello.
How you doing, Flora?
She says if she is happy with her new look and her husband is, that's her business. Kudos to her.
Very good. Very good.
Grace.
Hi, Grace.
Says one's free will.
Okay. All right. So as long as she's not unhealthy, we need to mind our own business. Now, granted, when you're a celebrity and you go online, we in your business. But yeah, so I agree. But I do agree that as long as she likes it, as long as her husband likes it, then we do need to mind our business. But y'all know me, I'm gonna put another little spin on it, and it's gonna be a mental health spin, not for her specifically, but I'll talk to you about it. I'm gonna see if we have any other comments.
Swansley, hello.
Hi, Swansley.
I've seen her from Swansley in a while. 1% with her choosing how she wants to look, all is well.
Okay.
And then I remember Miss Pauline says, don't pay attention to the haters. People who don't mean you well will always have something to say. I love her.
That's a fact. I love Serena also. Okay. Anyone else?
Yes. Macy says, no business but hers.
All right, Medhead. So y'all are all right. Y'all are my people. Let me bring this in here, though, just to be the advocate, the Lucifer's advocate. Here's what happens. So I sat here and mentioned how over the years, people have called her all kinds of names. Now, granted, to be fair, there have been men, especially men who like a thick body and a little waist and all of that, who've always praised her body. But the louder voices have been the ones in traditional or legacy media who have commented, oh, she's too big, or oh, she's too muscular, or her body's too masculine. And so imagine your whole life hearing that. And then now you've had 2 babies. Now you're not exercising with the ease that you used to, because now you have to get up and go to the gym like the rest of us. Whereas before, the gym was your job, playing tennis was your job. And so I do imagine that, a lot of the extra kind of soft weight or fat weight was not by choice. And so she is getting growner, in her 40s. And so that also puts her at risk if she's overweight or living with obesity. That puts her at risk for high blood pressure, diabetes, heart disease, all of the things. She's still a human. And so we don't know her reasons for losing weight. Like, a lot of people will look and just assume that she wants to be skinny, and she might just want to be skinny. Okay. But we don't know if she saw some numbers that made her think, oh shoot, I'm starting to push it. I'm getting grown. I want to get healthier. So bottom line, my point is, whether she's skinny or on the bigger side, the haters are going to hate. Okay. They were just as loud talking badly about her when she was heavy. And now they're loud talking badly about her because she's thin. And so I really hope that she is doing whatever work she needs to do to make sure that she is well with herself, and that she's looking for motivation, that is pure and within her heart. Because truth be told, yes, oh, I'm just doing this for myself. I want to do this, just to be healthy. That could be true with her. But we still do live in a Eurocentric world, especially for someone at her financial level, her socioeconomic status. Just like for most of us who were born, at a certain time. And look, heck, even now, the standard of beauty was considered to be very thin, very white, very blonde. Look at the original Barbie. You don't have to look too far. It's taken work to get multicultural representation. So even as a little girl, when you look at what's normal, quote unquote, and what's pretty, it hasn't looked like Serena. That's just the honest truth. Later on, yes, we got some black Barbie dolls, and check out the live from last week when we were talking about the Barbie with the diabetes. But originally that was that. Same thing with, things like Cabbage Patch dolls. The very original and the very bulk of them were white dolls, and moving forward, credit to Cabbage Patch. Very early on, they did come up with some black Cabbage Patch dolls, but just in commercials, it was a big deal when we started to see more black people in commercials. So my point is, for so long, not just with Serena, the standard of beauty has been very thin, very straight up and down. This BBL thing kind of came out of nowhere. We're being shapely. They didn't come out of nowhere. Being shapely was not in style when Janet Jackson was shapely or Serena was shapely. Being shapely didn't come in style, let's just be honest, until non-black females started showing up with large bottoms. Kim Kardashian, Jennifer Lopez. Okay. Am I telling the truth? Tell me if I'm not telling the truth. When people who were non-black had shapeliness, that's when it became popular. Let's take it a step further. I've been getting cornrows and braids since the beginning of time, but cornrows weren't popular until people like Bo Derek back in the day, if you know, or people like Kim and Chloe started getting hair braids. My point is, we can sit on here and hate on Serena for being thin and her body to start, her body's looking more Eurocentric. But if she's doing it not just for happiness, but to be more Eurocentric, the problem does not start or end with her. It's a systemic issue. And so everybody commenting and saying, come back, sis, come back, sis. Don't look at her, look at society. And I'm done. That's all I got to say on that. Anybody else before we close this thing out? Shador.
No, Dr. Frita.
All right. All right. But we had a nice little conversation today. We talked about bypass surgery with Taylor Swift's dad. So praying that he does well with his 5 vessels that got bypassed. And of course, we went on to talk about Trump and his ankles and chronic venous insufficiency, a common issue. So hopefully you'll share this as you give us a like with loved ones in case they have it as well. We talked about fibroids with Lupita Nyong'o, and we went back, talked about Venus Williams some more, of course. We talked about sepsis, septic shock, the signs, symptoms, what to do, and Ronnie Coleman. And then, of course, we ended off, y'all done messed around and made me mad, talking about Serena Williams and her body, okay? Her body, her choice. Everybody leave her alone. All right. So we don't actually have, the time is up, y'all, but we'll pick up and talk about some other things. Make sure that in addition to liking this, that you do follow, put notification bells on, and follow me on all social media platforms at Dr.Frita, because throughout the week I go in and I give you short form content. I did something just this weekend where I talked about 11 warning signs of kidney disease. I did that in some short form content that's going to be easy to view. And I also put a video out on my family reunion, my good old country down home family reunion. So if you go to IG and some of my other platforms, you'll see that. And then I will be giving you notifications of when I'm appearing this week on Truth Talks Live. So make sure you follow. Go to my one-stop shop, drfrita.com, where you'll see my favorite things, like my favorite blood pressure cuffs, my favorite juicer, all the things. All right. So I certainly thank y'all for watching. Thank you for your support. Thank you, Shador, for being my fabulous co-host. And we will see you next week, same time, same place for Medical Mondays. I'm Dr. Frita.